Hi, this is Chuck Gallagher. I'm here with my guest, Valda Ford. Valda is, well, I'd call you a sexologist, but that's probably not the right terminology.
We'll say expert.
Expert, there we go. I like that. Valda is a registered nurse, multiple master's degrees, deals with a lot of issues related to sex and education. In this particular case, we're talking about men's health and especially prostate health.
Right. Well, Chuck, you were saying that you had your PSA, you had a biopsy, the doctor suggested that you had surgery. He gave you 4 options. Which option did you choose?
Well, Valda, I didn't want any of them. I kind of wanted to stick with watchful waiting, but I was chicken because I thought, if I have prostate cancer at an early age, I'm not sure I want to, well, play chicken with it, and especially having seen my father-in-law die from prostate cancer, advanced prostate cancer, I concluded I needed to do something. And frankly, when I talk with a lot of men, they say, oh, just get it out. Oh, let's just get it out. I wasn't as aggressive with that idea. The idea of getting it out was fine.
Yeah.
But I went on an exploration. And in my case, I looked and I said, okay, well, I could have surgery, I could do radiation. Basically, the doctor had said to me, look, in your case, you probably want to have surgery, nerve-sparing surgery, so that I would continue to be able to have erections and have a normal sexual life, or as normal as possible under the circumstances. And I'll never forget this. Leaving the doctor's office when he suggested we have surgery in 2 weeks, who did 100 surgeries a year, I went back and went to Dr. Google.
Yes, Dr. Google is very bright.
Oh, Dr. Google is brilliant. The one thing it did, and I would say this to anybody looking, if you're looking, pay attention to the source from where you're getting the information.
Absolutely.
Because there's a lot of people that have a lot of opinions, and I'm sharing an opinion, and so are you in this series, but pay attention to the source, where it's coming from. In my case, the question was, what are the best locations for men's urology? And the answer was Johns Hopkins came up number 1. Why don't we start there?
Right. Well, there are good things to look. You can look online to find where the experts are. You can also, if you don't have faith in that, you can ask people. Right. You've had surgery. Where did you have it? What do you know about? You can also go to academic medical centers, to the Department of Urology, to say, if you were having surgery, where would you go?
Sure. The one thing that I found, now keep in mind, by the time people are seeing this, the world has changed dramatically.
Yes.
But at the time, one of the comments that was made was, well, you could have what I'm going to call a radical prostatectomy. I'll get that out in a minute. A regular radical prostatectomy, knife, fingers, etc. You could have a laparoscopic surgery, which seemed less invasive. Or at the time, you could have robotic surgery. Now, it appears in 2019 that has become almost the norm.
Yes.
But at its time, there were only 2 or 3 or maybe 4 of the Da Vinci machines in the United States, and one of them, of course, was at Johns Hopkins. And my surgeon did 600 robotic surgeries for prostatectomy in the preceding year.
Wow.
So I looked at that and said, okay, more experience, less invasive. The question of all questions was, if you remove the prostate, is it possible to remove it without removing the nerves that surround the prostate, so there is a chance I will not be impotent?
Right. Well, that's usually one of the biggest concerns for men. Anytime, it's part of the reason they don't even want to have anything. Sometimes they don't even want to know anything because they're afraid of that possibility.
Right.
So now, fortunately, there's a lot of work and a lot of research done to make sure that they can get rid of the cancer and still leave you with all the function that you want to have.
And I'm sure as we go down this rabbit hole, we will go way deeper into why you would choose certain things. But in my case, I chose surgery because I knew if there was a recurrence of prostate cancer, some of the other treatments were still available that could prolong my life in the event it wasn't captured initially. The one thing that I will say, and again, this is an opinion on my part, realize if this is captured early, you have time. So don't rush into anything, and make sure that the doctor you're choosing is patient and will do what's necessary in order to make sure you get the best outcome.
Absolutely. And make sure that our listeners understand that what you've heard of in the past, what your great-grandfather went through, and those people is totally a different world. And go get checked, and if you find something, follow through. But in the way you did, very smart, you took your time, you did some investigation, you found the best option for you, and probably the best option, period. And now you're here to tell other people about it.
Yeah, and you know, Valda, it's just as a PS to this, I was talking with my urologist the other day, and I don't live in the same place that I did when I was initially diagnosed. And it was a fascinating conversation. We were sitting there, and I'd gone in and had the blood tested. Hate to do it, but okay, need to. And we were just shooting the breeze, and I said, you know, Doc, what's it like realizing that insurance companies primarily dictate what you can make? I'm fascinated by that. And he said, well, it's tough. He said, you know, Chuck, he said, for men over 65 that have prostate cancer, if it's Medicare, in South Carolina, I get $1,080. I may be off on the number, but it was just a shade above $1,000 to do a radical prostatectomy. And Valda, I looked at him like, what are you talking about? And then he said, and I have to continue treating them for 90 days following the surgery. I was blown away. I said, well, let me get this right. You get a little over $1,000 to do a surgery. You're taking someone's life in your hands, and you got to treat them for 90 days. I thought, I get paid a lot more than that to speak.
Right. Well,
and no one's life is at risk.
That is one of the big problems of our healthcare system, and that is also why there are many doctors who will not take patients who only have a government-based source of health insurance, which is very unfortunate. So I'm very happy that you could get the care that you needed, that you were able to afford it, or your insurance was there to do it, and that wasn't a question for you. But let me also say that there are plenty of really great doctors who have decided that they will take whatever amount there is because of their oath, and they want to do the best they can.
Right. Well, the one thing that struck me is what normally would be a 2-hour surgery. In my case, I don't know why. I was under, so I didn't know anything anyway, but it turned out to be 7 hours. And the fact that the doctor would take the time to be thorough and spare the nerves, I am deeply indebted for, because under the pressure they're under today, I can understand the need for speed, and that isn't always the need for great outcomes.
Yeah, we always hope that the first priority will be to do the best that they can for the person who is in their care.
Right. By the way, a little side note, because we've had side notes in this thing. I remember, because of course they're going to strip me naked, I took a Sharpie and I wrote a little note on myself, spare the nerves, and drew a little line, because I just wanted to make sure he knew. One last message. I just want you to know, Doc, you know, keep me functioning if you can.
Yeah, I'm a person and not a condition.
Yeah, absolutely. My name is Chuck Gallagher. My guest is Valda Ford. We're talking about men's health, especially prostate health. I hope you have been tuning into this series. And again, we're going down the rabbit hole deeper, and we'll continue that process.
Awesome.